Okay, hi, my name is George Scharfenberger. Originally this panel was supposed to be moderated by Sally Stansfield from the WHO. Unfortunately, she was unable to join us, and because it was a conversation type panel, we tried to get Oprah, but she also wasn't available, so you get me. What we're trying to do here is, and this is really the inflection point in the symposium, we're very happy that we've created the kind of frustration in terms of participation, because that was really the purpose of this. The lateness of our time is another indicator of how much there is to discuss and confirms the importance of our idea of having a 3-semester-long process of discussion, which will lead then hopefully to a decade-long research agenda on this topic. So, you know, I've just kind of been noting, this panel is to talk really about where we go from here. What should be our agenda? What should we be thinking about? What should we be talking about? We've talked about infrastructure, income, jobs, delivery models, including the private sector, education, information, behavior change, biology and epidemiology, housing, risk reduction, social safety nets, political power, governance, technology, and sustainability, just to mention a few. But really, what is it that we should be focusing on? So this panel was asked to really look forward a little bit, to try to imagine that this panel is taking place in the year 2020 or even 2030. How has the world, how have slums changed? And if so, what are the implications of those imagined change on the kind of research that we need to be doing now? I won't introduce the three panelists to my immediate left. Ndola Prada has kindly joined us as part of this panel. I'll just mention that she's a physician and an assistant adjunct professor here at UC Berkeley. She's also the scientific director for the Bixby Center and medical director of venture strategies. And maybe I'll just give her a head start, because you've heard from the other three, to maybe reflect a little bit about this future, and then we'll engage all of you in what is hopefully really a conversation more than a presentation and question and answer. I should add then that the next stage really goes back entirely to you. I hope that you will all stay for the lunch, not only for the lunch, but this is really the opportunity we're going to record and listen to you and what you see as what we should be putting in priorities in research at UC Berkeley on slum health. So, Ndola?
Thank you. I'm really glad to be given this opportunity to participate. I actually prepared something a little bit more formal, but after all these discussions, I think that I would like to, and following what you started, George, about what should we be talking about, I would like to share with you or make some comments and share with you some of the challenges that health systems are facing, and maybe are those the solutions to go ahead. One of the things that I would like to comment on and go back is what Lee mentioned about the acknowledgement of the slum population. And the acknowledgement is so important. And when he mentioned, it came back to me almost like 20 years ago when I started working in public health in Angola, where the word slum, which in Portuguese, in Angola we call the museke, like the favela in Brazil, we couldn't use in our reporting of the health outcomes of those specific populations. We would have to say peri-urban populations, because it was more classy and avoided sort of the confrontation of the difficulties of those settlements that we had to deal with. So it's very important, and I think that moving forward, one of the things that we researchers should focus on when we talk about health outcomes, whichever areas, reproductive health or environmental health, we should disaggregate the populations that we study according to the settlements where they live. A little bit like Dr. Zulu presented this morning, so that policymakers, program planners, and the donors and the overall communities do see the differences that exist between populations living in those settlements and all the other ones, because it has been becoming increasingly more difficult that, for example, even the UNICEF's last survey, multiple indicator cluster survey in Angola, the differences between urban and rural were so insignificant that they decided not to publish by rural-urban populations. They just showed the total, because it was almost shameful to show how so badly the urban population were doing compared to the rural. But one of the things, for example, how can health systems deal with those issues? And I want to mention one example that I know in sub-Saharan Africa of the Minister of Health in Ethiopia that has restructured itself to actually, instead of being disease sort of oriented departments or groups of diseases, they are actually according to target population. So they have the pastoralist department, and under that then come the disease issues. So that the programs, the health programs related to those specific populations have to deal with how they behave, what are their norms. Some of them are nomads or semi-nomads. How to schedule, for example, immunization campaigns according to their normal behavior of when do they go to the field and when they come back, etc. Is that an answer for some of the challenges that health systems are facing in providing services for this growing urban population in slums? I'm not sure, especially because a lot of the same countries that are trying to look at targeting services to specific populations that they have to serve, they also are very dependent on donor funding. And as you know, the donor funding are usually disease-specific and very vertical. So it's very challenging. And I as a professional, healthcare professional that does health system research, it is a huge challenge. But it's also important to notice, and I will bring here the example of one of the most important challenges, in my view, would be for this population in terms of healthcare would be access and affordability. And we saw some examples of the voucher system, public-private partnerships, lowering prices to increase access to slum population. However, we don't really know right now, and I challenge all of us to do evaluations. We can distribute the vouchers, but are they being used by the slum populations that are in need? That is the part that we don't know. And I give you some statistics from maternal mortality. That is something that is my passion, that is at heart. In the slums in Nairobi, where actually projects of voucher systems do exist for safe delivery, the deaths, maternal deaths between 2005, or 2003 and 2007, of all maternal deaths in the slums, only 21% of the women had any contact during the disease and up to the death with any healthcare professional. 21% of all that have died between 2003 and 2007. So they are there, they are close by, but they're not using it. So it is something that we need to have into consideration. And I think I'm going to stop here.
Great. Before turning over to the audience, let me just ask our keynote speaker, who now put a number of challenges before us and kind of ended it by saying, let's get going. Where do we go from here? Having listened to this, if you were to advise this community of academics and activists, very engaged academics, what should we be looking at as we prepare for the world of 2020?
All right, thanks. Is this on? Yeah, I think from my perspective, it's very encouraging listening to the other speakers that a lot of the issues I was talking about are being tackled already from different angles. But the main problem that we still have with addressing problems of slum dwellers is fragmentation. One, in terms of research, in terms of interventions, and so on. When you look at one of the slums where I worked for a number of years, Korogosho in Nairobi, for instance, there are over 200 NGOs registered to be working there, doing every small piece of work here and there. So the question is, what are we going to achieve? I think a lot of these programs are being designed, just to help those few people there, the 20 or 100 people. When you come up and ask them what impact have you had, they'll always give you examples of people that they have moved out of poverty and so on. But when you look at the scale of the problem, the growth of the urban population, the growth of urban poverty that we are seeing in the statistics and so on, we are not going to resolve this problem by having this sort of fragmentation. So how do we bring it all together? how do we actually come up with interventions, cost-effective interventions that can be scaled up to reach out to more communities, to more people, and so on. I think that is really the ultimate solution. And to do that, it's some of the examples we've seen here, the sort of partnerships, collaboration involving researchers, service providers, community-based organizations that are trying to empower communities, and so on. We have to adopt those sort of approaches. But I think what is missing is actually the evidence to demonstrate, to show what has worked in different places. I think you can talk to people. Each one of us can have stories of, this project did this project did that, but there's no proper documentation. In 2007, the Rockefeller Foundation organized what they called the Urban Summit at their Bellagio Center in Italy. And I happened to attend one of the sessions that focused on health vulnerabilities of the urban poor. And as part of that, we asked actually to write a background paper on what has worked in Africa in terms of addressing the health vulnerabilities of the urban poor. And we did a search, actually, the literature and so on. There are sporadic sort of examples here and there, but not properly documented, not properly evaluated, and so on. So the Rockefeller Foundation at that point was thinking about maybe bringing a lot of donors together to start a major program to address urban health vulnerabilities, but they didn't get much out of what was done not only in Africa. There was another one that was done in Latin America, another one that was done in Asia, and that was the cross-cutting limitation that a lot is happening, but it's not really together. We don't know what is really working. We don't know what can really be scaled up. If people mobilized money to say, okay, there's this 10 million, for instance, to improve $10 million to try, or $100 million to improve the situation of the urban poor, say in Ethiopia or in Nairobi or whatever, what are we going to do? Is it slum upgrading? What can we do about livelihoods? Is it microcredit and so on? I was fascinated by the questions that came up. I think one of the things also working in Kenya, one of the NGOs there called Jamii Bora, one of the things that they realized is that when it comes to microcredit, if you don't combine it with health insurance, that microcredit really doesn't help. A lot of their people actually fall behind in paying back the money when there's a major illness in the family. So slum dwellers are already paying a lot of money for outpatient care, as we have seen, and maybe paying more than even what the rest of the communities are paying. They're already paying more than they should be paying on water and so on. So the problem is not really money. The issue is how do we really make sure that the services that they are receiving are of good quality and so on. And I think that's where research can play a big role in trying to guide those who are in the services, the policymakers and so on, to define what are these, whether it's multidimensional packages, which has to be the way to go as opposed to vertical programs, as Ndola said. But that's really where we need to focus on, and measuring the impact and helping all these NGOs that are working in these communities to design their programs so that at the end of the day, they can demonstrate what sort of impact they are having. And in the end, we can do mapping and see which ones have the most promise to be scaled up to improve the lives of many people and many communities.
Okay, thank you very much. Now I'd like to really encourage the audience to participate, not necessarily with just questions, but also with comments, observations of your own. Where do we go from here? What should be our priorities? So, please.
Yeah, I have a question for all the panelists. I'm concerned with the health and nutrition of young children, and I work in Latin America, and most recently also I've been to Southeast Asia. And I've been in rural areas and urban areas, and I think traditionally we thought of the rural areas as being more the centers of poverty, and that the lowest income families had the worst health in their children. But one thing that I've seen recently over the past 5 or 10 years is that actually there might be some shift in that, I think because of the lack of clean water. What what I'm seeing is that when we don't have clean and free water available to the people, then soda companies like Coca-Cola are stepping in and saying, well, we'll provide you a safe alternative, and actually they're bringing down the price of Coke so it's less than bottled water. In El Salvador, where I work, Coke is a quarter of the price of bottled water, and they sell Coke in 10-liter volumes called family pack, 4 2.5-liter packs, family pack. And now families are giving their children Coke morning, noon, and night, and they're even putting it into the baby bottle for babies 6 months of age. And it's ruining children's oral health. The kids have a mouthful of cavities they can't eat, and they're becoming malnourished. So, and actually the children that are looking best are the poorest children in the most isolated areas, because Coke's not getting in there. They're just doing the traditional foods, whereas the urban areas and the families that have a little disposable money, they're the ones that are spending the money on Coca-Cola, and their health is being ruined. So my concern is this: how do we ensure access to safe and free or affordable water so that the industries aren't going to come in and market something that's further damaging children's health?
Let me just very quickly repeat the question for the video. No, but very quickly, one of the problems clearly is a lack of safe water. One of the solutions has been the provision of, by different kind of market forces, of sodas and other kinds of non-healthy, perhaps nutritionally unsafe products. How do you see, you know, how does one compete with Coca-Cola, if you would, in providing safe drinking or liquids to urban populations?
Coca-Cola to provide water in the same bottle?
They do sell water, but
At the same price, the
soda's
quarter.
a quarter of the price of the water. Yeah, exactly.
Any reflections from the group? Yeah.
I don't know if there's an answer to it, but one of the questions there is ownership, because when these companies do come in, they do take up a lot of the water supply to produce the processed drinks and things like that. And there's even been issues in the United States of Coke companies like buying the clean water supplies, even just in Northern California, and then having that fight. So I don't know of any examples in developing countries where that's played out, but I know that that's.
So is one of the problems kind of commercial soft drink providers, and just coming back from Ethiopia, perhaps beer providers, kind of taking over the best sources of clean water? Yeah.
One comment I would have, you see globally the large investor-owned companies like Suez Environment or Veolia coming in and taking control, and it almost has to be, for success, a corporation of that magnitude. For an NGO to try to compete against a corporation like Coke, that's not going to happen. So it has to have a force that's of equal magnitude, and those companies, for example, in Havana, Suez Environment has accepted a 50-year return on investment in order to revamp the drinking water infrastructure of Havana. So, you know what I'm saying? You have to sort of expect to meet that magnitude with that magnitude. I can't see how it would happen otherwise if the political force isn't already there to control it. If you don't have, you know, stable political environment and consistency in the ministries of environment to control that, then, and it's switching over to the private sector, then it has to be an equally powerful drinking water sector to fight against the market forces, I think.
Thank you. Other comments or questions about the research agenda?
Can I just
sorry.
continue? So, you know, there's this sort of a new development among corporate society called corporate social responsibility, and there are, you know, these groups who actually try to really take more responsibility about providing something back to the community. And there's one group in Singapore. It's actually run by my former high school classmate, Kwon Ping Ho, who was the head of the Banyan Tree Resorts and Hotels. And so one of the first resort area that he created was in Phuket, Thailand. It was kind of a rural kind of a very underdeveloped area. And one of the things he had to do was to be able to provide a lot of water, clean water. And what he decided to do first, before he built the hotels, was to create this desalinization plant. And he used his own corporate money to do this. So they are able to provide this clean, fresh water from this plant. And then after that, he built the resort. And he's in this organization called Corporate Social Responsibility. And if there are more Coca-Cola company, people, companies like that could actually take the responsibility, provide water in addition to be able to sell their products. I think that's one thing we haven't really talked about. Sort of trying to get corporations to take more responsibility in upgrading or doing something.
Relevant to this, I think the Nestle campaign, or anti-Nestle campaign, if you would, I think really did have an impact in terms of their corporate approach to poorer communities. So perhaps that's a good model in response to your issue. Yeah.
So I have two questions. One, Hi, my name is Amit. I'm from the Bixby Center. I have two questions. One is, in practical terms, how do we ensure the formal recognition of slum population? Since we're a team or a community here, I'm just curious what our panelists have to say for what we can actually do. Two, Dr. Zulu and Dr. Patel described the importance of unmet need for family planning, especially among vulnerable populations in our community of interest, urban slums. And in Mr. Coburn's presentation, you described a very integrated approach. Where does reproductive and sexual health come into this integrated slum health approach? Does it need its own specific component? Thank you.
Maybe let me just start by saying quickly about the water issue. I think that there's a big, what you might call a water conspiracy, which I think is much greater in the developing world than even in the North, where all of us grew up drinking tap water, but all of a sudden now we all have to buy water, and at prices that are higher than petrol, which has to come all the way from the Gulf and so on. So, but this is happening. The prices keep going up and so on. And I think when we talk about really addressing the water issue, we can talk about the private sector coming in and so on. But this has to be seen really as one of the core responsibilities of the government, to make sure that people have access to water. And when you look at the situation like in Kenya, we've also we've looked at some other countries in sub-Saharan Africa. In Malawi, for instance, you go into informal settlements, the government has provided water there. The extent of slumness or the slums are not as explosive as in Kenya. But I think if we get to a point where the government recognizes the slums, getting to your point of how do you actually achieve that? When they actually get to, I don't know how you actually do that, but when they actually get to recognize the slums as really, places where people are living and so on, at the very least, they have to define the basic services, amenities that should be there, and water and sanitation has to be provided. I mean, people in slums follow regulations. Like in Kenya, in 2004, for instance, the government said all houses in the slum settlements that are under the high voltage electricity lines people should move, otherwise they'll be demolished. People were given a 3-month notice. People moved out. But then the government did nothing. Many of them came back after a few months. There's police in some of the slum settlements. I think people, for the most part, are law-abiding citizens. And if the government would come in and regulate what is happening, whether it's with health care, to make sure that people, for the money they are paying, they are not being exploited. If the government can come in and make sure that instead of allowing these vendors to steal water from the city council pipes, the city council actually comes in or gets into partnerships with the private sector or people who are legally connected to make sure that people are getting safe water, because it's tap water getting there, but it's unsafe water. So I think there has to be somewhere where the international community, the civil society organizations, and the people in the slums have to say, this is really where the buck stops. And I think when it comes to water, it has to be the state.
Any other comments on the question of legal representation or recognition, rather, of slums and slum dwellers, and/or the role of sexual health and family planning?
Well, I would say that the counting and enumeration work and mapping work is really critical to literally put slum dwellers on the map. In many countries, they just continue to not be recognized as part of the population, and then there's a whole reverberation about lack of services and lack of attention from the more formal sector. So to the extent that's happening, that there are stories and techniques and partnerships that are shared, I would say an organization called Slum and Shack Dwellers International, which is a global network of NGOs and others that are working to do this kind of work, to document and map slum dwellers and their living conditions and their situation, and build that sort of local political power is an important first and necessary step for recognition. I think, to do upgrading and to think about family planning as a separate issue is not, in my view, an integrated strategy. So that health services and family planning needs to be part of the upgrading process. Those practitioners and those folks need to be at the table when we're thinking about housing. When we're thinking about, because a lot of what we talk about is access to essential services, whether it's healthcare, transportation, economic opportunities, and other essential services to get through your day. And clearly, family planning questions and issues need to be at that table. Sometimes they are, but more often they're not.
I agree with the Jason. I also wanted to mention that as researchers, it will be our responsibility, to ensure that the counting is done, but also in surveys such as the World Bank Living Standard Measurement surveys or any poverty surveys, UNICEF's multiple indicator cluster surveys, demographic and health surveys that usually are sponsored by the US government in many African countries, that actually the analysis of the urban population is disaggregated by slum dwelling and other urban. You can use the UN Habitat definition or create your own definition as long as it's well described and that it divides sort of those who are in the normal urban settlements versus the other with the less information. And I think that would also open the door, so when evaluations of health programs happen, that we get in the habit of evaluating according to those categories. So that, for example, when we say that contraceptive prevalence in an urban area is 35%, that we know where the 35% is coming from. Is it 70 from the other urban and 20 from the slums, or what is the breakdown? Instead of masking the all urban altogether, because that's what we usually do. And I think that if we consistently do that for all sorts of studies of health and disease and other indicators of urbanization, education, etc., it will be visible, very visible, to policymakers and program planners, so they can hide behind sort of the overall urban.
Okay, again, unfortunately, for reasons of time, we're going to have to pause it there. And I say pause because this is a conversation that is going to continue over lunch and then on into the next years, certainly with the colloquium. I want to thank the panelists, and while I invite Dr. Malcolm Potts to do a quick summary of what we've done so far today, I want to say, let's talk a little bit about what we're going to do over lunch. This is a very important part of the program, and it's really where we hope we can get as much input, different perspectives from all of you. At each table, there'll be a series of instructions and some questions, some guide questions, where we're looking to find out what you know, who's doing what, who we should be talking with, and who we should bring into this conversation around slum health. So I hope you'll all stay and actively participate in that. So, Dr. Potts?
One of the goals of this meeting is to be a launching pad for our 3 colloquia in the rest of the year. And I'd like, as a framework, to suggest 3 ideas. First of all, let's listen to the slum dwellers. Dr. Zulu told us that 32% are worried about sewage, 20% about water, and only 13% about health. So let's have an engineering colloquia, which I'm going to call the flying toilet colloquia, and which would bring together engineering, the School of Public Health, and the Blum Center. Secondly, I would suggest as a framework a colloquia which I'll call Acknowledging Slums, which would be very exciting. I think it would bring together BOLT, public policy, African studies, human rights, and would look at legal issues. Tenure is so important. Why do some slums in some parts of the world get legal tenure to their little slum houses and other ones don't? Why are governments not interested? There's a lot of themes there. Our colloquia have to be cross-disciplinary and cross-campus, and I think we have an opportunity coming out of this meeting to bring those together. The last one, I think, really should focus on family planning, because if we could have all wonderful solutions in the next 20 years to bring everybody that's now living out of slums into more reasonable, humane ways with good sewage and good water supplies and good access to health, we'd have another 1 billion people living in the present situation. We're not going to get anywhere unless we recognize that slowing population growth is something that's possible within a human rights framework. For example, Jason, if you have a micro loan system, those people should be distributing pills and condoms. Very easy to do. It's been done in some places. We have to do that. My tie says you can't see this on the thing. So it's cabbages and condoms. My watch has got condoms on the watch strap. We've got to be a little bit more sort of in your face about this, because as Dr. Zulu said, there aren't the jobs that people need. And one of the saddest statistics from the opening talk was that the slums are getting poorer. In Europe in the 19th century, the population of England never grew by more than 1% a year. We were able to make sewers, we were able to bring water in. You can't do that, even with modern technology, when countries are growing by 2 or 3% a year. So we have to bring these issues together. So that might be called the condom colloquia. I think we've got lots of opportunities, and the lunch is to refine ideas. You needn't necessarily take those 3 things, but we need to focus on things that bring ideas and things together, and from this very rich and imaginative campus. So I've enjoyed myself, and I think the rest of the year is going to be interesting. No PowerPoints in the colloquia, talking exchanges.
You know, I was going to summarize what we've heard, but everyone's dying to eat. And I think we've had a really lovely conversation. I think some of the most important pieces coming out of that, as we've talked about, is raising awareness of formal recognition, providing evidence that can really be used on many, many levels to go straight to action, involving empowerment, collaboration, partnerships, organizing the community, innovative approaches, and comprehensive solutions. So with that, I'm going to thank not just our wonderful panelists and speakers, and especially Dr. Zulu for coming all the way here to be with us today, but also the people who organized this. A special thanks to Miriam, who's been really wonderful, and Kate Bedford, and also Paige Paisano from the Bixby Center, Martha and Malcolm, who've been really firebrands throughout the process, and to George Scharfenberger for being along. And I'm sure I'm forgetting people, but everybody, thank you for your help in this. And as I said, we're going to first go out, and I think we can populate the tables on this side. And there is food out there already, box lunches. I've been told that the vegetarian lunches are over here as you exit, but please do come and share the lunch with us after you've shared the morning with us. And we will really try to, we'll give you a little time to eat, but then after that, maybe after 15 minutes, we'd like people to designate a person at their table who can then kind of take notes, because it's going to be really important to just get a couple things on the paper to mark what you've been talking about, and the solutions and the ideas that are coming from you, the audience. So thank you very much for your participation, everybody, and bon appétit.